I'm Dr. Len Lopez, and I'm at Parker University today here in Dallas, Texas. We're going to be talking about exercises that target the hip flexors and why you probably don't want to be overworking those muscles because they attribute to low back pain. Now, I'm here with Juliana, and we're going to show you some of the exercise you want to stay away from because it contributes to tight hip flexors. So with Juliana here, we're going to get her to lay on her back here, and these are some exercises you want to stay away from because they predominantly work your hip flexor, not your abdominal muscle, and most people already have tight hip flexor. And as you can see, the hip flexor runs along the front of your spine. It really attaches on the front of your spine and runs down to the inside of your thigh here. And so it's the muscle that's responsible for pulling your legs up. And not your abdominal muscle, mostly your hip flexor muscles are there. So that's really not a great exercise that's going to target your abdominal muscle. Another exercise you want to stay away from are straight-legged sit-ups. Kind of just the opposite direction, but it's now the hip flexors pulling you this way. Okay? It's not your abdominal muscle. You may feel your abdominal muscles contracting, but it's not a contraction. It's not going through a contracted motion. A third exercise you want to stay away from, or third and fourth, are things like V-ups. Okay, again, that's all hip flexor muscle. We want to stay away from that, unless, of course, you want to keep going to your physical therapist or chiropractor for back pain out there. V-ups are 6 inches. You know, people do lots of these drills like this. You know, I've seen them in soccer camps, ball camps. They're not really a great exercise you want to do out there. So let's try to reduce our risk of injury. Stay away from these kind of exercises so you can continue to work out. And a simple drill you can do, guys, to see if you have, if you have tight hip flexors is lay flat on the ground for about 30 seconds or a minute. See how you feel. And after about a minute or so, bend your knees. Bend both your knees, put them flat on the ground. After about a minute or so, or after you bend them, see how you feel. Do you notice any change in comfort? Does it feel better? Does it feel worse? If it feels better, more comfortable with your knees bent like this, that's an obvious indicator that you have tight hip flexors, and you probably need some attention on that. Thank you guys so much. I'm Dr. Len Lopez, and we've been talking about exercises that target the hip flexors and why you probably want to stay away from them so you don't hurt your low back.